Guys, welcome back to Medical Coding with Blue. Today's episode is all about the American Academy of Professional Coders COC Certification. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, disclaimer first. I am not employed with AAPC. They do not pay me to talk about this certification. I am just bringing this information as just for informational purposes. I am leaving the link for the description of this certification in the description box below. The only reason that I am doing this video again, because this is going to be the third time that I have talked about this very credential on its own, okay? This is the third time. The only reason that I'm doing it is because somebody commented that if I could talk about it because they have finished their program and they're not really sure what to do. My channel is chock full of advice videos. There are over 1,000 videos that I have done, and everything that you could possibly think of is there. And the cadence of what I say never changes, ever. My concern is for the coder. My concern is not about the business end of any organization. My concern is about you all, the coder. I will always encourage, if you are thinking about getting a certification, that you choose from one of the four: the CCS, the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC. Now the CPC is with AAPC. The CCS, the CCA, and the CCSP are all with the American Health Information Management Association, which is a separate organization. Now, you just need to pick from one of these four. If you look at the job listings, which is another thing that I implore new people to do, look at the job listings and see what certification are they asking for time and time again. You will see them asking for one of the four time and time again. And all that you need is one, okay? So when you do that, that way you know, okay, in my area, in this area, they're asking for this credential, they're asking for this credential. Either one of these credentials is fine, guys. Either one of them is fine. And again, all you need is one. But what you don't need to do, especially if you're a brand new medical coder, is be looking at all these other subspecialty and specialty credentials. Because all these four credentials, they all test on the same ideas. They test on diagnosis coding, they test on procedure coding, and depending on which certification, outpatient or inpatient, sometimes both, that is the CCS and the CCA, they do test on both. But if you are just, you only learned how to code outpatient, maybe your program prepped you for the CPC, you can also consider alternatively, if you don't want to sit for the CPC, you can look at sitting for the CCSP, because that's all outpatient as well. And again, all of these test you on reimbursement. They all test you on, HIPAA and things like that, and billing and that kind of thing. So they test you everybody on the same ideas, just different ways, okay? So that's something that you got to know. And in the first 2 years, I always tell brand new people, don't get more than one, because the more credentials that you get, the more CEUs or continuing education units you're going to need in order to support those credentials. And it gets expensive, guys. Even though you have 2 years to take to get them, right? You still will have to come up, especially if you go with one of the specialty certifications, you can only go through certain vendors to get those CEUs. You can't just report all the free ones, because even if you did, that may not be enough to support like the specialty certifications. So that's something that you have to be really careful about, and especially if it's taking you a while to find a job. And it's not easy for brand new people, because as I've said in many videos, these schools, they pump out coders and they say, oh yeah, they're ready for the real world. They just teach them how to pass a certification exam and then expect them to fly birdie fly. And a lot of them are not prepared. And so what happens is a lot of people end up losing out, because they don't know to study, and they don't know how hard to study, and they don't know what to study because they're not doing their research. Guys, take the time to do your research. I have a ton of videos on my channel about study helps and things like that. Don't ask me for the link, because I won't answer. They're all there in on my channel list. So check it out. Don't check it out. It's entirely up to you. But what I'm saying is, medical coding is about research. The health information field is about research. And researching things like these specialty credentials when you should really be concentrating on trying to pick from one of the four is, it's a futile waste of time. I'm just saying. So I'm going to read from the AAPC website so that y'all know, because this is the third video I will have done on the COC. The third. And I'm going to read from it. I'm going to leave this link in the description box so that way you all have access to it. But you can go at any time to AAPC or AHEMA and look at their certifications that they offer. So here we go. So it says, with physician, the COC, the Certified Outpatient Coder Certification Exam. With physicians choosing to join hospital groups over private practices, the need for certified outpatient coders continues to escalate, making the COC certification an even smarter career move. By passing the COC exam, employers recognize your mastery of outpatient hospital coding, including working knowledge of ambulatory payment classifications, payment status indicators, and MSDRGs. I'm going to stop it right there. Anytime you have a mastery certification, there's not going to be an apprentice status attached to it ever. If you don't have coding experience before you sit for this COC and you end up having the apprentice status on your name, on the credential, this says that you don't have experience. How can a credential show mastery when it has an apprentice status? I'm just asking a question. Just asking. And then it says, students who earn their COC credential go on to report outpatient services in a variety of settings, such as hospital emergency departments, outpatient hospital clinics, outpatient therapy departments, outpatient cancer centers, dialysis centers, outpatient radiology departments, and ambulatory surgical centers. Obtaining the COC credential shows that you have a proficiency in assigning accurate medical codes for diagnoses, procedures, and services performed in the outpatient setting, emergency department visits, outpatient clinic visits, same-day surgery, diagnostic testing, radiology and laboratory, and outpatient therapies, physical therapy, occupational therapy, speech therapy, and chemotherapy. Funny, because these are all on the CPC exam as well. Proficiency across a wide range of services, including evaluation and management, anesthesia, surgical services, radiology, pathology, and medicine, knowledge of the coding rules and regulations, along with a proficiency on issues regarding medical coding compliance and reimbursement under the outpatient grouping systems. COCs can better handle issues such as medical necessity, claims denials, bundling issues, and charge capture. The ability to integrate coding and reimbursement rule changes in a timely manner to include updating the charge description master, fee updates, and the field locators on the UBO4. Correctly completing a CMS 1500 for ASC services and UBO4 for outpatient services, including applying appropriate modifiers, knowledge of anatomy, physiology, and medical terminology, commensurate with ability to correctly code provider services and diagnoses. A working knowledge in assigning ICD-10-CM codes from volumes 1 and 2. I was unaware that there was a volume 2 of ICD-10-CM. Note, ICD-10 PCS and DRG assignment inpatient coding are not tested on the COC exam. Then why would you mention it? Why would you mention it? So the COC apprentice, when you have passed the COC exam, you will receive your COC-A credential, which signifies apprenticeship standing. You remain an apprentice until you fulfill the 2-year experience requirement, at which time you will submit proof of meeting the requirement and your A will be removed. And then it talks about how to meet those things. Let's see, what else we got here. You guys can see that on the website. The COC is a 100 multiple choice question exam. It's proctored 4 hours to complete the exam, and it is open book with the manuals. The COC consists of questions regarding the correct application of CPT, HCPCS Level 2 procedure codes and supply codes, and ICD-10-CM diagnosis codes for coding and billing outpatient facility / hospital and freestanding ASC services for insurance companies. The COC exam covers medical terminology, anatomy, coding guidelines, payment methodologies, compliance, ICD-10-CM, CPT, HCPCS Level 2 coding, surgery and modifiers and cases. Sounds a lot like the CPC to me. I'm just saying. So with that said, it's entirely up to you which certification you want to get. Again, I can only tell you in my experience from what I've seen in these job listings, because yes, I still look at the job listings because I have a show called Medical Coding with Blue that requires me to know about what the industry wants. What are they looking for? And again, time and time again, they are looking for those 4 main medical coding certifications. And all you need is one, because I have yet to see a job listing say candidate must have multiple credentials to get this job. And even if it did, for some odd reason, somebody hears me say that and they say, so, oh, you know what? I'm going to go ahead and I'm going to make a job listing that says candidate must have more than one certification. I would really consider looking at that really closely. Like, what are you doing? Because even if you have multiple certifications, it doesn't mean that you have more knowledge than somebody who's really studied hard and has one certification. And for those of you who think that, having multiple credentials is what you need in order to make money, that's not the way that it is in this field. The way that you make money is through knowledge and intelligence. That's how you make money. And for my nurses that think, oh, okay, well, cool, no, you need experience. You need experience and knowledge in the fact that you know how to code. And coding being more than just circling from a super bill, because that's not even coding, okay? That's just circling from a super bill. To really be taken seriously in coding, it is actual abstracting diagnoses, meaning that you have these diagnoses and procedures that are already selected, and you have to go through and make sure that those are correct. And if not, you take them out, you put in the more appropriate codes that fit the documentation, because it is all about matching what is there in the documentation and what is being reported. And that is what we do as coders. We make sure that everything is there and everything is supported. That is how you submit clean claims. That is how, things stay the way that they're supposed to be, which is in a good way. And, how patients are able to have really comprehensive records that help them no matter where they go. It's not going to be a guessing game from, if they get care at one hospital and go to a hospital out of state. It's not going to be this huge question of what happened to this patient. What kind of treatment did they get? Because, I don't understand the documentation. Well, if the coder is doing their job like they should be, that documentation is going to look really good, because they're going to have worked with the provider, so that way the provider is documenting everything like they're supposed to, and that everything is going to be clear. Okay, so with that said, I know it's a confusing time when it comes to, like, this is the beginning of, like, where do I go and how do I do all these things? How do I know what certification to get? It's just as simple as looking at the job listings. The job listings is going to tell you what the employers are looking for and what they want. It's not a mystery. They don't tell you, well, we're looking for coders, but that's it. No, they're going to tell you, we are looking for certified medical coders, or somebody who's going to be certified within the next 6 months through the American Health Information Management Association or the American Academy of Professional Coders. Sometimes they will list out all of the certifications that they will accept, the CCS, CCA, CCSP, or the CPC. So there's a lot of job listings that are like that, and I tell you guys to take the time to look through those job listings. And you can't just look under medical coder. You have to look under health information technician, health information management. Sometimes they put it like that, and they're looking for a coder and they say health information management, because the people that are writing these job listings, they're often from HR. So HR doesn't really understand unless they know personally about coding, they're not really going to understand. They're going to know the basics. And then you may see some of these job listings say candidate must be proficient in ICD-9. And we haven't been in ICD-9, and that is totally out of date. We haven't been in there since the implementation of ICD-10, which was in October of 2015. So if you see a job listing asking for ICD-9 experience, that is a very old template that they are using, and they should really update that template. I'm just saying, but they do that, and that's how you know that not all places are going to understand what coders do. They're just going to know, hey, we need a coder, and they're not going to be able to know what those things are unless they're actually in it. So that's something that you got to know. But be very careful about the credentials that you get. Be careful not to compare yourself to others in your class, maybe getting all of these credentials because they want to get all these credentials on their name. They want to look so impressive. If I am a hiring manager, it's not going to impress me. Somebody who has a trail of credentials after their name and no experience to back it up, that doesn't impress me. That just tells me that you can pass a test, and anybody can pass a test if you study hard enough, right? So that's the thing, in passing tests does not translate to knowledge. It doesn't. Experience does. Experience will translate it to knowledge. And that's something that you guys got to know. Choosing between all of these ones, and somebody asked me the other day on the show too about, I'm interested in the CIC. How did you know about the CIC? I said, well, are you certified? No. Okay, so how did you know about the CIC then? What makes that one so special that you're asking about that particular one? And the CIC, if you don't know, is a certified inpatient coder with AAPC. They're not like AHIMA, where AHIMA has their inpatient, they administer their tests. The CCS and the CCA both have inpatient and outpatient coding. They don't, AHIMA does not have a credential only for inpatient coding. They have it combined, and so that's something that you got to know. And AAPC has it on its own because they don't have a combined credential like AHIMA does with the CCS and the CCA. So they knew about that, but how did you know about the CIC, but you don't know about the CPC, and that's where you should start? I mean, that's kind of jumping into the deep end of the pool there, that's just weird, So guys, do your research, and really do it on your own so that you're not sitting here getting all this information from other people and you don't know what their motives are. For some, they're trying to sell a program. For others, they think they know and they don't know. And so that's all a part of it. Again, guys, I'm giving you guys my unbiased take on it. I say unbiased because even though I'm with the HEMA, I still support telling people about AAPC because I think for some people, they need that. They need what AAPC can provide, even though it is more expensive to maintain those credentials. It is more, but I mean, it's up to the individual. And if the individual is not doing their research, well, then you get what you get put in front of, right? Which is something like this. This is why I tell you guys, critical thinking is very key to this field. It worries me when I see some of the comments because I'm like, why would you even ask that question? If you're not applying those critical thinking skills, you wouldn't even be asking that, right? And so that's the thing. We live in a society now that has these little short, quick, ticky-tock things, and I will always say that I'm going to always have long shows being that my shows are almost 20 minutes, 25 minutes a piece, average. And the reason that I do that is because I explain things beginning, middle, and end. I am not into these little ticky-tock, 1 minute, 60 second, I'm going to explain this to you in 60 seconds. The more that you do that, the shorter your attention span. The shorter your attention span, the more willing that you are to take whatever's being put in front of you without critical thinking. Your brain needs to critical think. This is why I tell you guys, look through the videos and make sure that you do your research when you're going to get certified. That's pretty much all I have to say about that. And I think I've been pretty clear about what I recommend, which is one of the 4. The CCS, the CCA, the CCSP, or the CPC. Any one of these 4, and these are the only ones that I recommend for medical coding. The only ones. Now, if you want to talk about CDI is something completely different. I'm talking about medical coding. One of the 4, and that's all you need, okay? Because I did 13 years of my career with the CCA. 1 certification. I changed hearts and minds. I dealt with people who snubbed their nose at me because, oh, you have a CCA. Okay, so who taught you? Yeah, I'm just saying. And I worked hard. I worked hard for my knowledge, and I'm still working hard for my knowledge because now I hold the CCSP and the CCS. So, you know, I'm going to keep them both because I got the CCSP first. Yeah, that's the only reason why. So, but with that said, I'm going to go ahead and wrap this one up. Again, take a look through the description box. It's going to have this link for this particular certification. But like I said, all you need is one of the 4. So if this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.